Okay, welcome everyone, and thanks for coming along. This is being recorded. You've probably seen the pop-up on the screen. I'm not going to get everyone to introduce themselves because we've got quite a lot to get through. So if you can introduce yourselves in the chat, that would be great. I'm Donna from Voluntary Action Camden, and I'm sort of leading this today. We've decided to do this as a part of the Camden's consultation on their health and wellbeing strategy, mainly so we get a voluntary sector perspective, I guess. So what we're going to do today will actually be ongoing. You can contribute afterwards to this sort of collective overview that we're trying to put together, and you'll find out how that happens as we go along. So first of all, the health and wellbeing strategy, I don't know if everyone has seen the consultation. There is a link in the chat that Ricky has put up, and I'm going to screen share, hopefully, and talk through it in a moment. I've just got that up ready, sorry. So the strategy is really rooted in and dependent on, for success, collaboration. So it's a bit different really from past strategies that we've had in Camden. It is obviously intricately linked to what's going on at neighbourhood level, if you're part of neighbourhood working groups, that kind of stuff. And it is also will have influence on what happens at the new emerging integrated care system level for North Central London. And of course, it is the framework and guiding document for the integrated care partnership in Camden. And that's all made quite clear at the beginning of the strategy. The strategy is really accessible, even the whole document, you know, read it, it's good. But I suppose the big point that we need to keep getting across is that this is not a strategy about, oh, how's that strategy going to affect us? Let's do a consultation and, you know, look at how the sector are affected by this. It's much more what we're doing to deliver it. So we're all implicated. We're all stakeholders in the delivery of this strategy. And the consultation, as I go through it, you will see it, you know, Camden are asking those questions as well, you know, who's doing this stuff? So that's really what I want to focus on with this. So what I'm going to do is go through the strategy consultation. There are 6 themes that have been identified that they're asking around. The first 3 are quite big, blue sky thinking, big vision stuff, and then the numbers 4 to 6 are actually quite practical application of, you know, work to deliver on those sort of great big themes and principles. So I'm going to go through the 6 themes and just say something about them and try and get some context there for what we're asking people to do. And then we're going to switch over to a Padlet. There'll be a link. There should be links in the chat, but if you don't want to use that, we can do it for you, or you can put your comments in the chat. This is quite a small group, so we can still talk through that. And so we've got a wall with those themes, and what we're asking people to do, there should be 3 questions popping up in the chat, is think about the work they do, or the work they know other people are doing, or if you're a local resident, think about the services and opportunities for you in your locality that fit into this picture. And then we're asking you to think about collaboration. What type of collaboration would make what you do better? How would it improve the stuff you do for your users? And then finally, you know, what's missing? So, you know, what hasn't, there might, I mean, I can identify things sometimes in social prescribing that there are gaps where there quite simply is a service that doesn't exist or hasn't been invented yet. You know, what are those things that we need to be looking at? Where are those sort of really those barriers, those gaps that are really stopping something happening or impeding a collaboration, that kind of stuff. So if you can think about those things while we're looking at the wall that we want you to contribute to, what we will end up with, hopefully, is a kind of voluntary sector perspective on the delivery of this strategy. And that's the aim of the game. Afterwards, it will be on our website. People can continue to contribute. And also from VAC's point of view, we are spending quite a lot of time at the moment at these boards and working groups around this emerging integrated partnership and system. So we want all your voices contributing to examples that we're giving of how things might be delivered on the ground. So that, and actually, you know, roots into bringing other people into those conversations for their very specific expertise, that kind of stuff. So I'm going to share the screen now and go through the initial. So as we're going through, right, sorry. Okay, as I'm going through this, if, yeah, think about this in the context of your work when we get onto those 6 proposals. And to be honest, you don't really, if you haven't read the strategy, it doesn't really matter. Still think about your work in the context of collaboration and delivering for residents along some of these broad themes. In some ways, most things will fit somewhere. So this is the introduction to the strategy, really does set the scene around how this fits with the whole partnership and system approach, and the importance really of getting involved in it for the voluntary sector particularly, but also for residents. You know, everybody is a stakeholder. So these are the 6 themes. So as you can see, the top 3 are quite big stuff. So I'm going to start with this one. And this is population health. It should be. Yep, there it is. Can everyone see my screen? Yep, this screen.
Yeah.
So this is quite a different approach, I suppose. It's not looking at these 4 pillars of population health. Are often looked at quite separately, and I guess particularly in the public sector where you have departmental things are focused on within silos. So in the, you know, you have the NHS looking at health, you might have social care in the council looking at care. So now, not just bringing those 2 things together, but everything else. So all these things have overlaps and integrate. And of course, then we're being asked, do you agree with adopting a population health approach? I mean, from my perspective, I guess in the voluntary sector, it's a bit of a no-brainer. There are all these interlocking aspects of within one piece of work, really, or one project or service. And I think in many ways, this is what the sector does really well. And one of the focus areas around collaboration as well is going to be on looking at how the public sector can learn from voluntary sector and community-based approaches to health and supporting residents generally to, you know, live healthy lifestyles. So in terms of this, yeah, what is it you do that connects all these different things up? So, and that combination of lifestyle, experience of health and care services, and the places, communities you live in, and wider individual support networks. So if I were to give an example of that, of some of the work I've done, I have spent quite a long time supporting a neighbourhood forum. That's about planning. It's about location, somebody's neighbourhood, physical neighbourhood. But actually, the people who have been involved in that, the residents, are involved because they think the environment impacts on their health, which obviously it does. So that brings together environment, health, housing, social care, a whole range of different things interlocking just within that one project. So it's that's the kind of thinking. So to move on to the next one. So these are ways of working and guiding principles. I think probably there are people here who are covering at least one, if not all of these. Prioritizing prevention. I mean, I think this is a really big one, because I think in the sector we're very good at doing prevention, but it's not necessarily understood, for example, within health services or within broader public services. And often because people they don't know what's out there preventing people ending up in their services, and they don't really know how to measure it. So I think this is an area where the sector can actually give quite a lot of steer on how to, if you like. And then we have the inequalities and disproportionality, which lots of organisations are working in, empowering communities, and then integrating and communicating and sharing responsibility. These are quite big pillars, I guess, in terms of the whole collaborative and interactive networked approach to delivering. The question the council is asking here are generally about people's expectations, I suppose, but also about gaps. But I think, you know, we should be focusing on how we do these things and what we are doing that fit. So number 3 is the long-term vision, and this is the 3 areas that Camden have put this sort of strategy within, which are start well, live well, and age well, which, yeah, cover the whole population. So I think, yeah, again, you know, these are fairly obvious things for people to look at and look at what they might be delivering in these contexts. And I sort of, actually, maybe I'll wait till the next one, because the next 3 are quite specific in these areas, and they're from the work plan. The strategy also has an outline work plan, which gives, I suppose, more structure to the big vision stuff. So good work and employment. This is the live well section. Now, I know, you know, there are plenty of employment focused initiatives going on in the voluntary sector, and of course they are interconnecting with health, they're interconnecting with housing, they're interconnecting with all sorts of things. So think about those. If it's not you delivering something, you might have something in your neighborhood going on that needs to be identified in this sort of picture as an important component. Again, on these questions, the questions are really asking who else could be involved in progressing this priority. So the bigger and the richer the picture we can build here, the better, really. And the next one is healthy and ready for school. So this is within the Start Well theme. And, you know, you don't have to be working with preschool or school-age children to be delivering in this area. You know, you could be working on environmental projects. And that's, we have to sort of think of that big picture the whole time. You could be working on all kinds of things. And again, so that's what they're asking here. Who else could be involved in progressing that priority? And the final one is age well, and something we're all working on, I think, is the community connectedness and friendships. I guess this isn't just age well, actually. This goes across the board, really. I think I know through our social prescribing, we come across a lot of people who aren't elderly, who are feeling disconnected and lonely. So there's a lot of work going on here, and this could be working across all sorts. So those are the 6 themes. We're going to switch now to that's it. This is the board, the Padlet, and everyone should have a link. So we've got, sorry, that's my crazy computer. So we've got the themes across the top, and then they're in brackets what those mean on a couple of them, just as prompts. It might not be appropriate to fit what you do into any particular one of them. I mean, that doesn't really matter. I mean, we can sort this out later, and it'll be an ongoing sort of piece of work, really, to build up a picture. So I'm going to hand over to Kevin to explain how to use this.
Thanks, Donna. So really just, these are very simple. So you've got the headings. So you've got the 6 headings from the strategy at the top. So the first 3 are the more general ones, as Donna was saying. And then the second 3 are the more specific ones, good work and employment, etc. And then you'll see under each heading is a plus. And if you click on the plus, it creates a little, a sort of little post-it. So yeah, Donna, if you click on, there you go. And you can make it, you can give it a subject. It's like an email, you can give it a subject. So do you want to type in example, and then okay, and then down below you can write something, invites you to write something incredible, but you can write something sensible. And that's it. And then if you press the publish, the pink publish, that will just appear as the next comment under whichever heading you were writing under. That's it.
So I took that out of, long time ago.
So, and that you can also, you'll see underneath them, there's a little rating star, and you'll see that there's also a little comment, add comment. So you can comment on other people's posts, and you can also rate them, just give them a rating out of 5 stars. And it's I like Padlet because it is just simple. That's it. There's no complication, and then it will stay up as well. So if you hang on to your link, you can revisit it later. It will be up. Caroline, is that a question for me?
It is. It is. Thank you, Kevin, for answering my question, hopefully. So I'm going to really struggle with this. So I'm visually impaired and not that good with my fingers at the moment. So that's tiny for me to do anything on. I've thought of something with it. Well, I mean, I've read some of the strategy before, but not all of it. But I don't know which bits to put my ideas in, if you see what I mean. And so I don't know where to put stuff, and I can't see to do it, to be honest. So
so what you can do today, we've got myself and Ricky on the call. So we're happy to take comments verbally, and then we can put them in.
Perfect.
Or at a later date, however you communicate, you could send them to us afterwards if you've got a preferred communication method, and when
verbal
we can add
would be
them in.
great, if that's possible.
Yeah.
Thank you.
Okay, back to you, Donna.
Okay, so has everybody got access to the Padlet? I can't see everyone actually because of I don't think, oh, hang on, let's see. Right. Yeah, I can see a thumbs up. I can see, I think perhaps the question, is there anyone else who needs to do this verbally, or people can also use the chat to write things in if that is preferable. Right, I can't see any hands up. I'm flicking through, so. So we're going to spend about 15 minutes, 20 minutes, perhaps we've probably got, yeah, on sort of filling this in. And you should be able to see what people are putting up on your screen. So that's it. So if anyone's got any questions, yeah, put your virtual hand up, and I will keep flicking through the participant list. Right, Caroline.
I'm only putting my hand up to just say, hey, who can I speak to? When can I speak to them? If you see what I mean, only for that, please.
Okay.
Thank you.
Kevin.
I mean, I think, should we take those? We can do that now if you want to do that within the group. So yeah, I mean, whenever is convenient, I think.
So is it convenient for me to say something, is what I want to know?
Yeah, sure. Donna, you're inviting people to just sort of fire away now, are you? So
yeah, just get
so Caroline,
on.
yes, if you want me to put something under.
Thank you very much. Thank you very much. So what I was just, thank you, Kevin. I really appreciate this. Thank you so much. So kind of like in the first, it was somewhere near the first bit, there was things about the population health strategy and the ways of working. And I just felt that it was missing out the fact that about expert patients in terms of both individually, because I mean, I've got multimorbidity, and so I'm an expert patient. And so when I go and see, if I go and see any specialists, they don't know anything about anything else. So I have to educate them about it. So that's on an individual level. But I think there's also something about expert patients being involved in co-creating services. And we saw a whole lot of new services come up for COVID that was seriously not co-created. That was just like, I really understand why they did that, because there was just a ton of stuff to do. But I just want to point out the fact that patients can be experts, both as individuals and in terms of designing and co-creating services. In those two ways, please.
Okay. And is that under Is that under working principles, or?
I don't know, Han. I don't know, because I thought of it when I read the population health approach was on there, because it was kind of like, I thought, what about expert patients? They're missing out, and when the ways of working. So I don't know where they went. So that was another of my little problems about, I don't know which one to put it under, if you see what I mean.
Okay. I'm not.
That's because they're kind of like thinking in the silos of services that they're existing, you know. Yeah. So that's a kind of an issue for me. I definitely agree with the population health approach in general, but it's kind of still thinking about silo-y stuff, if you see what I mean, the standard way of thinking. People who've made their services for them rather than their patients or clients.
Can I say something?
Go.
Yeah.
I'm not in charge, but say yeah. Yes. Mary. Speak, Mary.
Yes.
I'm looking at the pad, so I can't see your faces. I'm working on a laptop.
Mm-hmm.
So it's, I could squeeze both things, you know, to try and get them both on the screen. But why is it so wide that you've got to pan across? Why can't you make the columns a bit narrower so people can, because I mean, I've got particular difficulty at the moment because my laptop's a bit elderly and it doesn't respond very well, you know, to my touch. it's one of those Macs where you just touch it. But you know, so it's really hard work. But I had to panic. I thought, oh, I'm working with something that's supposed to connect people, and I had to pan right across the page. So why can't you design it with thinner columns? I know that it would look a bit weird because, you know, it would.
Mary, it's completely out of our hands. You'd have to speak to Padlet about that. It's a pre-formatted thing. There's no way you can change the column.
Oh, I see. Padlet. Padlet's a geek, is it?
Yeah, one of those. Yeah. I know. I mean, I've got a big computer screen here, and it's you know, not great.
I could do it. Yeah, I could do it upstairs. My husband made me, because he knew my laptop was dying, so he made me spend another £1,000 and buy this monster machine, which I hardly ever use because I'm so used to my little laptop. So it might be easier on that. But anyway, that's my bit of feedback so far. But so you know, if I were visually impaired and couldn't, it's already difficult asking us to do two things at once because you know, you can't look at this pad at the same time. I was lucky I managed to find it. Sorry, do I sound like a rat bag?
No, Mary, I totally get what you said. The whole thing about doing so much at once when you're doing online stuff is really confusing. And it's a really tricky one when we are doing online sessions. But I think, you know, the fallback just always has to be people can talk through it if they need to. If that's, you know, and I really appreciate that people do work on quite small screens as well. So
I mean, it was a godsend when I first got this laptop because it meant I could sort of put it in an envelope and take it to meetings and take minutes, you know. So right now you've got the screen share. I managed to get rid of the make it so I can make the screen smaller. Right, get rid of the chat. I'm just trying to see if I can see both at once on my screen. Yeah,
can you have any breakout rooms, because otherwise I've got some other points I was going to make to Kevin, but I understand that other people are wanting to say things. Can you do breakout rooms, Donna?
Okay, I'll shut up now.
Oh, no, I'm not trying to shut you up. I'm just trying to see whether
a few things.
Right, I've got them both on the screen. Rah, rah, rah. I tell you, it's hard work.
Kevin, can you set up a breakout room for
I've got two more things.
Caroline?
I've got two more points to make, please.
Yeah, sure.
Thanks, Kevin. While that's happening, can I just point out, because Donna, you said you had this thing about services that don't exist. I hope you do know about the We Make Camden kit. So you can ask for £1,500 for an experimental type thing, if you see what I mean.
Yeah.
Please do that.
Yeah, I need to. We don't provide services in that context, so that's the actually pushing that out to people is.
So are we allowed to say something that should be included?
Yeah, go for it.
It's not our thing. I'm on the border. We live in Islington, but we're literally on the border. The kids went to school in Camden, the doctor's in Camden, and most of my time was in Camden, actually. I went to a community centre to do exercise classes. Mm-hmm. They knocked it down. So I think that to keep people mobile and healthy in that physical sense, they should be encouraging people to go to exercise classes. But the funding's cut. Community centres have closed and been turned into flats. Blah blah blah. Is that on it anywhere?
Right. Okay.
Exercise classes, especially for elderly people. I'm elderly now.
I mean, I'm
And
going
the-
to put that under the
and the
guidance
other
of
thing-
guiding principles for now.
The other thing, I read in The Guardian that Camden is one of the places with the lowest uptake of the jab. Now, I thought our GP they were straight on the ball. They sent the thing, we got it, everything was okay for us. But apparently, a bigger percentage, it's one of the boroughs with the biggest percentage of people. Now, is it because of anti-vax campaigning? Is it because they're not reaching certain communities? Is it because it's not available? What is going on in Camden about the vaccinations? And I find this whole thing very embarrassing because for years I've mixed with people who campaigning about the monetary system, the banking system, and some of these people have turned into anti-vaxxers, and I find it hugely embarrassing. Have they gone bonkers? You know, is it people who don't like the bankers? Do they turn into anti-vaxxers? I don't know. Some of my people have been former friends have been going on demonstrations with Piers Corbyn, which haven't been in the news, but apparently they're quite big demonstrations. Anyway, what is going on in Camden?
I don't think that's really for this meeting, Mary. I mean, we put out information, we put out the NCL updates, but we're not. I've not done any preparation to answer a general question like that. I mean, I don't think that's completely accurate, Mary. I don't think Camden's actually got a very low death rate compared to other central London boroughs.
Okay, good.
Camden's death rate is quite low. But
what I was thinking of was about messages reaching certain communities. You know, that's the sort of thing you could do something about. What's the messaging? What's the information available to certain ethnic communities? You know, what messaging are they getting? Why are they so frightened? Anyway, I don't have any connection. I haven't got a clue. Sorry.
Well, I think that I mean, it is a relevant question to the sector because it's actually about trust, isn't it? And it's about marginalized communities not trusting officials. And if they're trying to throw you out of the country, of course you don't trust the government. So if they then tell you to get a vaccine, well, you know, and they've gone from trying to throw you out of the country to telling you to get a vaccine, then why do you trust suddenly trust them? So I think there is a really pertinent issue there.
I mean, for years and years, we had a cleaning lady who we knew was a...
Let me just finish the point, Mary. Mary, let me just finish the point. So the point is that trust can be built through voluntary organizations. So the community groups of those groups, their refugee groups, their new community groups, they can then establish trust, and then you have to create a link. So that's some of what the sector has been doing, and what VAC has been doing is creating a link through GPs and particularly GPs from those communities, so they can then speak at events and they can then try to overcome the distrust. But I think trust is at the heart of the issue there. So I think that let's because that's an important thing to capture in this role, because then the sector is showing that it has a really important role as ever in reaching those on the margins, so that the strategy isn't just a mainstream thing. It does reach all of Camden, and Camden's a very diverse borough, of course.
Yeah, thanks, Kevin.
So how are we doing? Donna, you're going to capture that point. What the reason I'm still,
I mean, it's
so I just explain what's going on, because I'm the host. I can't join Caroline, but Ricky and Caroline have gone into a meeting separately. So Ricky is now taking her points verbally. So that's why I'm still here and Ricky has disappeared.
And a couple of times when I've gone into local shops, quite intelligent people running these shops who are in ethnic communities, and I mention something about what's going on in the news, they've got no idea what's going on in the news. Didn't know what I was talking about. So they're quite bright people who are not being reached. It must be something to do with social media, or they got their own connection, you know, their own sources of information. I mean, I know if you're working in a shop, you haven't got time to listen to the news, but just blank. They have no idea what I was talking about.
Yes, but some people don't listen to the news anyway, and they get information from social media.
Yes, that's what I'm saying.
Perilous.
Yeah, yeah. But people that, you know, I would have, who are quite bright, you know, who are running businesses.
Well, apparently people in America, families in America won't meet up for that Thanksgiving because they've all fallen out about the vaccine. That's so political in America. I heard of some restaurants and bars that are turning away people wearing masks.
Yeah, I heard that on the news. But I was saying in the local shop, I was saying, we don't go to supermarkets, you know, we're shopping local. That's why we're coming to you. And I was referring to all this thing about transport and everything. I had no idea what they were talking about. So we've never run a car, you know, just didn't know what the point I was making.
I'm sorry, I've made a couple of anonymous comments. I'm obviously not using the Padlet properly.
I think that's fine.
Sorry about that. They didn't mean to be anonymous though. That's what I'm saying.
Oh.
So we have
the same. Mine are anonymous as well because I didn't know how to not make them anonymous.
Yeah, I think unless you put your name, it's going to not know, or unless you log in, so it's probably not going to know. But if you want to claim the comment, then just add your name. I see no one is putting anything under the healthy and ready for school.
Oh, right. Well,
that's a.
No one here with them.
Are they doing anything for preschool children?
Engaging people.
Children having to pay for nursery education now, preschool education. My daughter's got a child, 18, just over a year, paying half her salary to send him to nursery, not in this borough, in another borough.
I think there are some quite interesting things going on that are not actually directly related to childcare and things, you know, stuff like street closure and greening projects and stuff that are quite, you know, in some neighborhoods where children don't have much opportunity to play outside, that kind of stuff. I mean, all that kind of thing contributes, doesn't it? It's
You mean, so if you keep the traffic out, you make an area that's safe to play?
yeah, that's what's been happening in some neighborhoods. Yeah.
Sounds good.
Yeah, well, you know, and I mean, it's good on a number of levels, isn't it? Having somewhere to play, but also cleaner air.
Yes.
It's
I've made some comments for healthy and ready for school.
I tried to rate something and failed.
Oh dear. Oh yes,
Yeah, if you want me to do anything like that, say I can. I'm sort of
On the health advocacy, can use the lived experience of disabled people to improve health access. I was going to rate that.
okay.
if you click on the rate.
Oh,
I did that. I failed.
Oh
Nothing
dear.
happened when I did that. Or maybe I tried clicking.
right. Yes, I just did that. I think. So, yeah, that has rated it. Yeah.
Okay, perfect. So, thank you.
So it comes up with anonymous.
Yeah, you have to write your name if you want your name or your organisation's name. I think on the top, that or somewhere.
Who's AK, please?
Okay.
That's me, Alexis Keir from Elfrida
Oh,
Rathbone.
right, yes. Alexis.
Hi, Alexis.
Hello,
I just
everyone.
your thing. So where are you from, Alexis? I'm sorry, I don't know.
I work for Elfrida Rathbone Camden, which is based in Kentish Town, works with young disabled people and also delivers family support and delivers the Community Champions scheme in Kentish Town.
Okay, great. Thank you for that. Because I was trying to put a comment on about expertise of people, like, so quote patients or clients or whatever, and so you know a load of experts, don't you? And I'm an expert, and you know loads of experts, if you see what I mean. And I totally agree with what you're saying there about let's use that expertise rather than pretending we don't know anything.
Yes, and funders love that. You know, it sort of really establishes project need. When you're looking for funding and you can say, we've spoken to our users and they've said this.
But why do we have to be speaking to users? Why can't users be in charge of things?
Oh yes, that as well. Yes, I mean, you could, you know, do a funding application with users. They can run projects. Absolutely.
Well, I've managed to post something.
Well, I'm upset that my comments haven't been rated, but I'm not sure I've done it properly, actually.
Right, I don't.
But Caroline, funders love, well, the lottery anyway, sort of loves, you know, research action projects and, you know, users having a, you know, running projects.
Yeah. So Alexis, how often do your users get lottery funding on that basis?
So I'm just finishing my comment.
Sorry.
That's all right. I'm just like before I.
Sorry.
That's okay. I will just publish.
Publish away.
Where am I? Come back to find the screen again. Sorry, I'm lost. Our funding, I'm sure, is the case for lots of organisations. It's quite itty bitty. And I must stress, Elfrida is not a user-led organisation. Absolutely, you know, trying to support service users' voice and co-production and leadership. I just posted, you know, wonderful news for us, or for me to share, is that this year we're able to, we've got funding to restart a project called Young People for Inclusion, which ran before in the mid 2010s, and that was delivered in partnership with young disabled people around across a range of issues, supporting their ability to influence the services they receive. That's not lottery funded, that's from City Bridge.
How much money did you get?
We had enough for 5 years worth of funding, which is really good.
Yeah.
It's a sole worker project. lottery funding. I guess we see the fund. We apply for funding across several different areas of work. Also for our family support, our education delivery, our creative therapy. So it's just on the case. We were unsuccessful earlier this year in terms of our family support period, and our family support services are smaller now than they have been for a long time, because they relied heavily on lottery funding.
So the lottery don't always love stuff, do they? So Alexa's going to ask you a question, which is that, so I know a £1,500 isn't very much for if you want a whole massive service, that I think you were talking about, but you do know that there's the We Make Camden kit.
Can I just say, I heard you say that to someone else before, and my ears did perk up, and I absolutely...
Please perk your ears up, because it's an easy...
They're perked.
Please do something, not just... You know what I mean? So it's a £1,500, and you can apply twice in a year, and it's an easy form, or it should be. If it's not an easy form, if it's actually people rather than an organisation, then the council will help you apply. So maybe some of your young people could apply by themselves, or not by themselves, but with.
Absolutely.
And there's somebody called Yasmin at the council whose kind of job is to help people apply. I'm on the participatory grant making panel. So, and we're saying yes, if you see what I mean. Okay. And so the priority actions, and so maybe everyone else is also listening, because I want everybody to apply if they've got some good idea that's going to benefit people in Camden. The priority areas are children and young people, which doesn't doesn't stop at 13 or whatever, it goes bigger, and food, diversity and positions of power, and sustainability and environmental stuff on estates. I might have got those actual words slightly wrong, but if you look up the words We Make Camden Kit, as in KIT, on the internet, you'll get into it. And it should be easy. And if it isn't, then say, look, she told me it was easy. It's not being easy. Why? Then someone must help you.
Thank you, Caroline. Thank you.
Okay, has everybody finished with their Padlet, writing their stuff up? We've got quite a few messages in the chat about people who want to continue it later. So the link will be sent out, and that's either because Saba, who has got no sound, and a couple of people who want to consult colleagues. So we will send this link out with the link to the recording, and people can continue to add to that, and hopefully build up an even richer picture. We've got some really good stuff there. Thank you very much for doing that. And hopefully we will continue it. I'm going to stop that screen sharing so I can see people. Right, that's better. Okay, so does anyone have any questions or anything else they want to raise about the strategy or the work they're doing that they think contributes to it?
So can we send this link round to members of our group?
Yeah, we'll send it out ASAP after this, and people can continue that. I've forgotten what the deadline is for the consultation.
It's
Have
the
any of you?
It's the 13th of December.
So there's a little while yet.
Yeah, but not long.
I mean, ideally, in the sort of longer term, I would like to see this kind of picture build, really, so that we can use that to draw on as things develop through actually delivering this strategy, and through, you know, the other work that is going on at neighbourhood level. So we have quite a good rich point of reference about what the sector is doing right now, and actually what it could be doing, and the collaborations that could be forming as things develop. There is going to be a lot of change. There's already a lot of change, we know that, but it's not going to stop. As the integrated care partnership develops in Camden, and then the system develops, there'll be a voluntary sector alliance sitting around that. And what happens in Camden will be taken to that board. And this kind of really voice around what the sector is actually doing, being able to pinpoint things and tell a story in those forums, or connect with people who are delivering important pieces of work or really relevant pieces of work, and get their voices heard at those forums is, you know, it's going to be key as we go along, and make sure the voluntary sector a really strong stakeholder in this whole new landscape that's emerging. So if anybody at any time wants to talk to me about any of that, you're very welcome to get in touch. But I know with some of you, I am very in touch with you anyway, chatting about things or calling on you to come and talk to someone. So hopefully that will expand and grow. If anybody has anything else to say, now's your chance.
You mentioned the word alliance. I've heard that somewhere else in the country. Is it a new buzzword? Alliance.
I don't know. I don't know if it's a new buzzword, Mary. It's actually, I mentioned it in the context of the Voluntary Sector Alliance,
yes,
which is being formed around the new integrated care system for North Central London. So that will be a voice for the voluntary sector. And I'm involved in some work around that. And the way that we've kind of want to focus it across the 5 boroughs, the voluntary sectors in the 5 boroughs, the CVSs, I guess, like us, is that is quite a fluid alliance, so that we can bring different people into it, and actually, depending on agendas, that we don't just have a place on the board or a one person doing everything, that there are lots of subgroups, there are lots of different places where the voluntary sector voice can be heard. So we want to be able to draw on different expertise, different knowledge, different experience to take into that alliance. And that's the context I was talking about. And they're calling it a voluntary sector alliance at the moment. So
thank you.
That was my reference. So we'll be doing some work around that in the new year, no doubt. So keep an eye on our newsletter.
Thank you.
Okay, anything else? I think we can probably wrap it up then. Lovely to see everyone. And maybe in the new year, we'll be doing more real things.